During the lockdown, the Ministry of Health spent time training health workers and equipping the regional referral hospitals in anticipation of handling increased and probably severe cases of COVID-19 patients. However, 4 of the deceased victims were referred to government hospitals from private facilities. This, according to Associate Professor Freddie Sengoba at the Makerere University College of Health Sciences, was based on an assumption that the public would utilize the selected government facilities.
The diseases now are in the community, and people there navigate through the care system starting at a lower level. So health workers who are not being fully trained will be exposed. Private sector that has been totally left out of the game plan will be exposed. So we are now beginning to see that even the preparatory phase, I think we are so targeted. Now we need to do it to be broader. And so what we are going to see partly is trying to do more with the other providers where patients are likely to show.
So we've agreed that first of all, we need to take them through the same orientation. We need to do training for them. But they also need to make arrangements, similar arrangements like we have in government, of screening, having a very high index of suspicion. Then they isolate those they suspect before they refer them to the government training facilities.
This is in addition to announcing results of the dead more than 24 hours later. In one incident, a family in Mengo, Chisenyi, a Kampala suburb, received and buried a victim that the ministry later said succumbed to COVID-19 on the 24th of July. The Director General of Health Services, Dr. Henry Mwesigye, says none of the contacts has tested positive.
The biggest worry we've had is that we don't have the exact uplink to know where did this person get this COVID from. So there's a lot of work which is being done in Kisenyi. First of all, to trace the contacts, check them. Of course, we are doing a lot of screening and testing there, and make sure that if there's anybody sick, we quickly remove them.
Dr. Mwesigye explains why the results take longer in the labs.
Because we don't want to rush and announce, and then tomorrow another lab says negative, the other one says negative, and then you start retracting. On the quarantine sites, they have been complaining a lot. We have realized our mistake. We are prioritizing that. We are putting a special dedicated lab for quarantine sites.
Dr. Olive Kobosinje says the Ministry of Health did not set clear priorities to effectively handle COVID-19.
We need to say, what exactly do we want to see in the improved healthcare system? How many more health workers do we need in place? How many are we going to be training per month? How many hospital beds are we adding to the system? How many ICU beds are we? So we need to have targets. We can't say we are improving the healthcare system and we're the only ones who know what it is we are doing to improve it. I think that's not a good method.
In the last national address on the 30th of July, Health Minister Dr. Jane Ruth Acheng said the country has since registered 453 cases of community transmission, and to date, the origin of some cases is still a mystery. Professor Sengoba says the dissemination of information about the infection is still wanting.
We have not been very frank with the public to tell them that this information about COVID is complicated. They are not very straight answers. Sometimes we've simplified matters when we speak to the public, but oversimplifying them also means that we don't give the entire picture. And so confusion arises, or mistrust arises, or information is edited to be simple, but not exactly empowering.
Uganda currently has 1,102 recoveries of COVID-19 from 1,213 confirmed cases. Walter Mwesigye, NTV.